Things every mom must know. Hey moms, you're doing great. As your body changes and develops for your little one to grow and make room, it's important to remember that pregnancy should not be treated as a medical condition. Why do I say that? Well, oftentimes we think of some of the negatives associated with being pregnant. And these things might include stress and fatigue, digestive issues and reflux, being uncomfortable, having challenges to the immune system, anxiety, stress, and more stress. Oftentimes what we also see due to the changes from a physical perspective is an over-accentuation of spinal curvatures, which in all of that mumbo jumbo just means that we get a little bit more curve and a little bit more strain on that spine, which can then put more strain on what's really important, the central nervous system. And that central nervous system is going to be a key element of what we're talking about today. So the first real bit of cells and tissues to develop within the baby is going to be that part of the central nervous system. You're going to get formation of the neural plate, which is then going to then differentiate into what will be the brain, the central nervous system, and essentially the control center for everything. What's really, really cool and interesting is, as a mom, your central nervous system driving all of the changes that are happening through this pregnancy are essentially helping to then kickstart and get the baby central nervous system going too. So there's this very intricate connection going on. So going through your pregnancy, it's imperative to make sure that your central nervous system is functioning as best as it can be. So then the development of the baby can be as best it can be, right? Makes sense to me. So not only will this help the baby to grow and develop in a proper way, it can also help you stay more comfortable and more calm as you navigate this interesting time of being pregnant. Some things that we've noticed throughout the years of taking care of a lot of pregnant moms, and also Haley can vouch for this too, because we've got approximately 6 weeks to go and it's getting a little crazy in here. So these are some things that we see a lot with moms who are under consistent, regular chiropractic care. Mamas can better manage their stress and their anxiety. They don't get stuck in that gas pedal on sympathetic state. Fight or flight is easy. They're able to transition between the zone of super sympathetic if something upsets them, back into that parasympathetic part of the nervous system where she can rest and she can grow and she can develop. And that's where we really want to be when we're talking about developing and growing a baby, right? We want to be in growth phase. Regular chiropractic care will also reduce nerve irritation. This can promote healthy digestive function, which is intricately tied in with the central nervous system function and the immune system function. Kind of think of a triangle, and at each point of this triangle, you've got the central nervous system, the immune system, or the digestive system. Those all work together, and you want them all working together as best as possible. When they aren't, that's when we start to see some of the breakdowns that will eventually be termed symptoms. And then we get into that whole medical complex type of thing. And we get away from the amazing natural process that is growing a baby and having it. So in addition to providing from a neurological perspective, healthy chiropractic care, we also see some physical manifestations as a side effect that are pretty nice too, from what I've been told. Providing a state of pelvis and spinal balance allows for normal range of motion of the joints. And it's important because that normal range of motion of the joints also allows the soft tissue to function normally, not be too tight in certain areas, which then will let the baby move around as it needs to. Why is this important? Well, when a baby is born, the ideal positioning is going to be in a head down position. So the head can come out first and the rest of the body can follow. If due to soft tissue limitations or range of motion limitations, or things just feel stuck or get stuck, that baby may not be able to move around as much as it should or could be able to. This is how we end up with situations like a breech or a feet down and head is still up towards your head position. These are definitely not ideal, and these can lead to a lot of complications in delivery, such as cesarean sections, which again, a couple of videos ago I talked about the national rate being between 20 and 30%, which is high. In South Florida, it's about 70%. So if you are looking to have a natural birth with as little intervention as possible, it's important to be taking care of yourself throughout this whole process of pregnancy So then your labor and your delivery is going to just be easier and not be as strained. We talk about side effects a lot. Side effects of chiropractic care during pregnancy, let me tell you. Oftentimes we see an easier and a less stressful delivery. We'll see faster and easier recovery times from labor and delivery, and an overall promotion of a healthy pregnancy leading to a healthy delivery and a healthy baby. So let me tell you, whether it's your first, your second, your fifth, your seventh child, and you haven't had chiropractic care before, or you have, if you've been following us and seeing what we're putting out there and it resonates with you, give us a call. We always start with a free consultation over the phone. That allows you to feel us out and say, are these guys right for me? Allows us to look at your case and say, hey, I think this is something that we could help with and help you to have a healthy, less stressful pregnancy. It is not a medical condition. I can't wait to talk to you soon. We're so excited to meet you and help you in any way we can. Take care.